Did you know that while you're watching this video right now, more than 30 people around the world will suffer a stroke? That's one person every 2 seconds. Some will survive, but many won't. And among those who do, their lives may never be the same again. 1 in 6 people will experience a stroke at some point. That means if you're sitting with 5 friends, the odds say it could happen to one of you, or your spouse, or your brother, or you. And the scariest part? It often comes without warning. You could be talking with someone, laughing, maybe pouring a cup of coffee, and in the very next moment, that person collapses, unable to move or speak. It feels sudden. It feels random. But what if it didn't have to be? What if there were signs? What if you could spot them early, take action fast, and change how the story ends? You see, strokes don't always have to be deadly. They don't always have to leave someone paralyzed or unable to talk. The difference often comes down to time. So instead of watching helplessly, what if you could be the one who knew what to do? Because when it comes to strokes, every second matters. And the more you understand now, the better chance you have to protect yourself and the people you love. It was around 2:30 in the morning when Yogesh walked into his father's room to check on him. Just a quick glance. But what he saw will never leave his memory. His father was lying still, eyes open, lips parted, but no sound, no movement. He'd had a stroke. The ambulance was called. They rushed to the hospital, but it was already too late. The doctors explained that the stroke had likely started hours before anyone noticed, and by the time they got help, the damage had been done. His father passed away 2 days later. "I'll never forget that night," Yogesh wrote online. "I keep thinking, if we had only recognized the signs, if we had acted faster, maybe he'd still be here." Yogesh's story isn't unique. It's one of thousands we hear every year. A stroke in the middle of the night, a mother collapsing in the kitchen, a grandfather slurring his speech during a family dinner. In each of these stories, there's a common thread. The stroke came suddenly and the people around didn't know what was happening until it was too late. That's not said to scare you. It's said because knowledge is power, because the truth is, strokes can be survivable, even preventable, but only if we understand what causes them, how they happen, and how to act fast when every minute counts. So let's break it all down, one piece at a time. The human brain is a miracle of biology. It weighs only about 3 pounds, just 2% of your body's total mass, but it consumes over 20% of all the oxygen in your blood. That's how demanding it is. Every thought, every memory, every step you take requires a constant supply of oxygen carried by blood flowing through a vast network of arteries. Now imagine what happens when that flow suddenly stops. No oxygen, no nutrients. Within minutes, brain cells begin to suffocate. They shut down, they die. And once they're gone, they don't come back. That's what a stroke does. It cuts off the brain's lifeline. And it doesn't take long to leave permanent damage. Think about it this way. If you stop watering a garden, it might wilt after a few days. But if you cut off blood to the brain, parts of it can die in less than 5 minutes. That's how fragile our most vital organ really is. And the brain doesn't just affect your thoughts. Different parts of it control your ability to speak, to walk, to swallow, even to recognize your loved ones. So when a stroke hits, it's not just a brain problem, it's a you problem. It's about what you'll lose if blood flow isn't restored fast enough. That's why understanding what causes that blockage and how to respond is more than just medical knowledge. It could be the difference between living independently or not living at all. There are two main ways a stroke can strike. The first is a hemorrhagic stroke. This happens when a blood vessel in the brain bursts and bleeds into the surrounding tissue. It's like a pipe that suddenly ruptures under pressure, flooding the area and damaging everything nearby. But while this type of stroke is severe, it's actually the less common one. Far more often, about 87% of all strokes, are ischemic strokes. These occur when a blood vessel is blocked by a clot, cutting off the supply of oxygen-rich blood to a part of the brain. Think of it like a traffic jam in your arteries. Nothing gets through, and the backup can be deadly. But where do these clots come from? Sometimes they form right at the site of the blockage, due to a buildup of fatty plaque on the walls of blood vessels. Other times the clot forms somewhere else, like in the heart, then travels upstream until it gets stuck in a narrow artery in the brain. This traveling clot is called an embolism. Regardless of where it starts, the result is the same: a sudden, complete cutoff of blood to a portion of the brain. And when that happens, the clock starts ticking. Because every second a clot blocks blood flow, more brain cells are dying. And here's the twist: you might not feel any pain at all. Unlike your skin or muscles, the brain has no pain receptors. So the injury happens silently, invisibly, until symptoms appear. And by the time they do, the damage may already be underway. That's why spotting the signs early and understanding what kind of stroke it is can save precious time when it matters most. Picture this: your heart is beating as it should. Everything seems fine, but deep inside, something subtle changes. A small disruption in your heartbeat, maybe atrial fibrillation, causes the upper chambers of the heart to flutter instead of contract properly. And in that turbulence, a clot forms. It's tiny at first, just platelets and proteins clumping together. But it grows. Then, like a hitchhiker with no destination, it drifts. Carried by the current of your blood, it rides up through the arteries, into your neck, then toward your brain, until it reaches a vessel too narrow to pass through. That's where it stops. That's where the damage begins. This type of traveling clot is called an embolism, and when it gets lodged in a brain artery, it instantly blocks blood flow to everything downstream. The brain doesn't send pain signals when this happens. You don't feel a blockage. There's no warning siren. But the effects, they're immediate. If the clot blocks a vessel feeding the area responsible for language, you might suddenly slur your words or lose the ability to speak altogether. If it hits the motor cortex, one arm might go limp. Your face might droop on one side. You might collapse, unable to move or control your body. And the strangest part? Your mind might still be aware of what's happening, but unable to respond. Many stroke survivors describe it as being trapped inside their own body. The words are in their head, but they can't say them. They want to move, but nothing works. That's what makes strokes so terrifying. Not just the physical damage, but the helplessness, the silence, the isolation. But remember, just because it's quiet doesn't mean nothing's happening. By the time those symptoms appear, the brain cells are already dying. And if we wait too long to act, the loss becomes permanent. After a stroke begins, your body does try to respond. It may attempt to reroute blood through other vessels, trying to nourish the oxygen-starved areas of the brain. But the brain's backup system is limited, and it's rarely fast enough to prevent damage. Because once a clot has lodged in a key artery, it's like a dam shutting off a river. Within minutes, brain tissue starts to die, and the consequences are not just short-term. For many, a stroke leaves behind permanent changes, some visible, others quietly devastating. One side of the body may lose strength or coordination. Tasks as simple as brushing teeth or tying shoes suddenly require help. Speech may be slurred or vanish entirely. You might know what you want to say, but your mouth refuses to cooperate. Even more heartbreaking, memory fades, personality shifts. Some survivors no longer recognize their children's faces or their own. In the comments of the original video, a woman wrote about her father who had a stroke in his sleep. By the time they found him, hours had passed. He never walked again. Another shared that their mother, once a vibrant and witty woman, now struggles to remember what day it is. Every conversation resets like a record skipping. These aren't rare cases. They're common. And in so many of them, there's one thing people say again and again. If we had just gotten help sooner. It's a painful truth, but also a powerful one, because it means the window of opportunity is real and it's within reach if we know what to look for and act immediately. So instead of thinking, I'll wait and see, the mindset needs to shift to act now, decide later. Because waiting, even just 1 hour, can cost someone the rest of their life as they knew it. So how do you know if someone's having a stroke? There's a simple tool doctors and emergency responders use, and you can too. It's called the FAST test. Each letter stands for something critical. F is for face. Ask the person to smile. Does one side of their mouth droop? Is their expression lopsided? A is for arms. Have them raise both arms. Does one drift downward or not move at all? S is for speech. Ask them to repeat a simple phrase like, today is a sunny day. Are the words slurred, garbled, hard to understand? And finally, T is for time. Because time isn't just important, it's everything. The moment symptoms appear is the moment the clock starts ticking. Every minute that passes means more brain cells are dying. But here's something people often overlook. When you call emergency services, they'll ask, when was the last time this person was seen normal? That's crucial. The exact time helps doctors decide what treatments are safe and what might actually cause more harm. In one heartbreaking story from the comments, a family couldn't remember the exact time their mother first showed signs. Because of that, doctors couldn't give her the clot-busting drug that might have helped. She survived, but with lasting damage. So if you suspect a stroke, don't just act fast. Note the time. Write it down. Tell the paramedics. Burn it into memory. Because even if you're unsure, it's always better to call for help and be wrong than to wait and regret. And the more people who know this test, the more lives we can save. So let's say it again. Face, arms, speech, time. Spot it fast. Act even faster. When it comes to treating a stroke, time isn't just important. It's the dividing line between recovery and irreversible loss. And the first line of treatment, in many cases, is a medication called TPA, tissue plasminogen activator. It's a clot-busting drug given through an IV that dissolves the blockage and restores blood flow. If given within a few hours of the first symptoms, it can dramatically reduce long-term damage. Some patients walk out of the hospital days later, nearly back to normal. But there's a catch. TPA can only be used if the stroke is ischemic, caused by a clot, not hemorrhagic, which involves bleeding in the brain, and doctors can't just guess. That's why one of the first steps in the ER is a brain scan, usually a CT scan, to determine the stroke type. Here's something else many people don't know. TPA used to have a strict time limit, within 4.5 hours. But recent studies, including one in 2025 from China and others presented at the International Stroke Conference, show that in certain cases, with specialized imaging, TPA may still be safe and effective up to 24 hours after symptoms begin, especially if the brain tissue is still salvageable. That's a game changer. Still, not every patient is eligible. Some can't receive TPA due to medical history, like recent surgery or bleeding disorders, or if the clot is simply too large. In those cases, doctors may turn to a more direct approach, endovascular thrombectomy. It's a procedure where a thin, flexible tube, called a catheter, is inserted into an artery in the leg and carefully navigated all the way to the brain. Once it reaches the clot, a tiny device grabs it, like a trap, and pulls it out. It's delicate, it's high-tech, and it saves lives. One viewer shared that he had this procedure after collapsing in the bathroom. Doctors reached him in time, removed the clot, and today he's walking, talking, and living life again. It's miraculous, but it only works if the system kicks in quickly, if people recognize the signs, if the ambulance is called, if the stroke team is ready. That's why everything we've talked about, from knowing fast to knowing the time, is about getting someone to this moment. Because modern medicine can do amazing things, but it can't rewind the clock. Surviving a stroke is just the beginning. What comes after, the recovery, the adjustment, the quiet daily battles, is something most people never talk about. For some, the effects are visible: a cane, a wheelchair, slower speech, or limited movement. But for many, the deepest changes happen inside the mind. Studies show that nearly one-third of stroke survivors experience post-stroke cognitive impairment, memory loss, confusion, trouble concentrating, even personality changes. It's like waking up in a body that doesn't fully feel like yours, with a mind that no longer works the way it used to. Some survivors describe it as fog, others as disconnect. And for older adults, it can accelerate conditions like dementia. One study published in 2025 even found that people with higher levels of education, who've spent decades building their brain power, may experience a faster decline after a stroke. Why? Because their brains had more reserve. But once that reserve is broken, the fall is steep. That's the part no one prepares you for. You expect rehab. You expect to relearn how to walk or eat. But no one tells you that you might struggle to remember your grandchild's name or forget where you put the keys you just held a moment ago. In one comment, a daughter wrote about how her father survived his stroke, but slowly lost his ability to follow conversations. He used to be the sharpest man in the room. Now he stares at the TV, not sure what day it is. And that's not rare. That's real. But here's the other side of the story. Not all outcomes are this way. With quick treatment, proper rehab, support systems, and continued mental activity, recovery is possible. Some people rebuild their lives in powerful ways. So even if the journey is long, it's one worth starting early. Because what you do in those first hours and in the months that follow can shape the rest of your life. If someone came to mind while you watch this, don't wait. Share this video with them, because knowing the signs, knowing the risks, and knowing what to do could make the difference between life and a life forever changed. And if you want to learn more about how to protect your brain and your health, hit that subscribe button. One video at the right time might save the person you love most.